Joining me now is Dr. Vikas Maurya, Director Pulmonologist, Fortis Hospital. Appreciate your joining us, Dr. Maurya. Tell us, do you believe that this latest surge of COVID is being driven by the variant XBB1.16? Is that what is driving it? And is it true that this variant is such that vaccines also may not necessarily act as some kind of protection?
Yes, I think what the report has been so far coming out is that this variant is causing most of the infections at the moment related to COVID in India. And yes, and what we're seeing that yes, now for past few weeks, we are having increase in the number of the COVID cases. But yes, these are majority the milder cases. And so far, we have not seen any patient, we have got few patients who got admitted in the ICU with oxygen requirement as well. But they responded very well. So far, we have not seen any increase in the mortality with this disease. Yes, it may cause, escape with the vaccine, because the one patient who got admitted in the ICU, he got all 3 doses of vaccine, but still he got severe bilateral pneumonia, and he was admitted in ICU with high oxygen requirement. But yes, he responded to that.
But doctor, is it that those with prior respiratory diseases are most vulnerable to this variant? Is there a connect between having a prior respiratory condition and getting infected by this variant?
See, I would say is basically those who are high risk individual, like those who are elderly, those who are immunocompromised, those who have any chronic lung disease or chronic kidney disease, chronic liver disease, or any cardiac disease. Obviously, they are more liable. They may get more severe form of the disease. So it's not only the respiratory, but other chronic disease can also makes the immunity less, and these people can have more symptoms severe as compared to other people.
But doctor, what are the symptoms that one should be looking out for? Because when do you know that this is not just another respiratory disease and you possibly have COVID? Are you saying that the moment I experience any kind of cough or fever, I should immediately go and get myself tested for COVID?
See, it's the intensity of the symptom which what we are seeing with the COVID. COVID usually causes again the fever high, which doesn't go in 2-3 days, and then again it's come very rapidly. Start involving. If the patient is immunocompromised, start involving lower respiratory tract as well. But predominantly the symptoms are fever, prolonged fever, then cough, and very less symptoms of the nasal symptoms are very less. But again going very rapidly to involve the lungs, then yes, then we would think of then it could be COVID. But predominantly at the moment we are seeing only the milder form of the disease with fever, high fever, and with upper respiratory tract symptoms.
And what would you advise people? Are you